and also in some really important states of disease that I hope you will walk away from tonight feeling like you know more than the average person about. So it is our very beginning of 2024 American Heart Month. There are a lot of really great resources that many of you may already be familiar with, but if you feel inclined at the end of this talk to learn more about American Heart Association, their website is a really great resource that's geared to be very accessible to anyone who maybe is a patient or family member who's interested in learning more about their heart health. So I'm going to start tonight with a pop quiz for all of you. You may not yet feel like you're an expert in aortic conditions, but you probably recognize some of these faces. Don't worry, in the next slides I'm going to make them bigger for you. But even though aortic dissection, that's what we're going to be talking about, is a condition that most people haven't heard of or thought much about, you know people or know of people who have experienced this condition. And unfortunately, all 4 of the individuals we're going to talk about next ultimately lost their lives because of this condition. So King George II, he was known for many things, and if you need something to make you giggle tonight, go to the Wikipedia page on this guy, because he was not very well liked by a lot of the people that wrote historical accounts of his endeavors when he was the King of England in the late 1700s. He was notable at that time for actually being the king who had lived into the oldest age of any of his predecessors. He lived to be 77 years old, but on a day in his 77th year of life, he got up at 6 a.m. for his usual hot chocolate that he used to start his morning. He then went for some private time in the commode, and apparently had a very, very significant episode of straining related to his bowel movement and was found dead shortly thereafter. So at that time, when anyone in the royal family had a sudden or unexpected death, an autopsy was performed, and this was actually the first diagnosis in history of the condition that we're talking about, which is aortic dissection. Now, this is a face that I'm sure you all recognize. So Lucille Ball, she also lived to be 77, just a coincidence that it was that same age. And in 1989, she experienced sudden severe chest pain, initially thought to possibly be a heart attack. She was brought to one of the hospitals that I had trained at. I was not there at that time. And she ultimately underwent emergency surgery that was thought to be successful. She was discharged from the hospital and unfortunately died at home within a few days of having recovered from this big life-saving surgery. So we're going to talk about her a little bit more later. You might recall this name and face, Grant Wahl. He was a soccer journalist who was in his late 40s, and this was right when COVID was just starting to get better to the point where we were having a soccer World Cup again in 2022. And he died suddenly as a journalist reporting on the FIFA World Cup in 2022. Ultimately, he also had experienced the condition that we're talking about tonight. And you notice he was quite a bit younger than those other 2 we just talked about. And this face you probably recognize from sitcoms in the late 90s, early 2000s. This is John Ritter. And he is not only known for unfortunately losing his life to the disease we're focused on tonight, aortic dissection, but in his memory, his family established a foundation to really increase knowledge and understanding of this condition that often gets misdiagnosed, leading to delays in care and sometimes less than ideal outcomes. He was only 54, just a few days short of his 55th birthday, at home with his family, when he also developed severe chest pain, sought medical attention, and despite all efforts to save his life, he unfortunately died because of his aortic condition. So each of these men and women in those last few slides, they lost their life to the same disease. And as you heard me say in multiple slides there, this condition can present with symptoms that can be quite similar to a heart attack or even a stroke. This condition is often missed or misdiagnosed. And so I hope that you will feel like you walk away from tonight at least recognizing the language in the words aortic dissection, being familiar with some of the symptoms, so that maybe if someone that you know were to experience similar conditions, not only you could encourage them to seek medical attention, but recognize that not everything that looks like a heart attack is a heart attack. Rather than being the heart causing the attack, there's an aortic equivalent, almost an aorta attack, if you will, which we refer to medically as an acute aortic syndrome. And that includes bleeding from the aorta, ulcerations in the aorta, and also tears in the aortic wall. So for our objectives tonight, there really are 4 takeaways. We're going to talk about the normal function of the aorta. I think it is an absolutely extraordinary organ. We think of it as just being a passive tube, but it's really much more dynamic than that. So I want to give the aorta some credit. We're going to talk about how the aorta can dissect or tear. And we're also going to compare and contrast the symptoms of one of these aorta attacks to something like a more typical heart attack. And then at the end, we'll talk about some steps that you can take to improve your aortic health. So in terms of the normal function of the aorta, in this picture, you see the aorta is like this giant candy cane, and it extends all the way from our heart down to our legs. All the important arteries in our body that deliver oxygenated blood flow and nutrients through the bloodstream to all of the important organs in the body are originating from this blood vessel. So the aorta is our largest blood vessel. Its job is to deliver the blood from our heart to the rest of the body. It curves through our chest in that candy cane shape. And its purpose, we just discussed, bringing the oxygen and the nutrients through our bloodstream to the brain, to our extremities, to our other organs. And interestingly, in the chest, the average size of a normal healthy aorta is about 3.5 centimeters, so about that big around. Next, we're going to talk about what the normal characteristics of the aortic wall include. So we're looking at this head-on picture now as if we took that candy cane and cut a slice through it. And what you see in this slice of looking at that aortic wall head-on is that it has 3 layers. There's an inner layer, the intima, a middle layer that's called the media, and an outer layer that's called the adventitia. Now, if you were holding an aorta in your hand and looking at it, you wouldn't see 3 separate layers. They're stuck together very, very well at the cellular level. You'd have to look at it under a microscope in order to appreciate that there really are 3 elements to the aortic wall. And when a problem occurs with the aorta, the blood supply to the heart, the brain, and the entire body can be at risk. And because of that connection between these aortic emergencies and the blood supply to the heart, that's why this can look like a heart attack. Because it can compromise the blood supply to our brain. It can look deceptively like someone's having a stroke when really the inciting event is related to the aorta. And this is a disease that does not discriminate. So in my 4 slides, I showed you 3 men, 1 woman. They all happen to be Caucasian, but this is a disease that actually happens equally in men and in women across all countries and places in the world, all ethnicities. And so it's something that we all should have a little bit more awareness of, because none of us are have the luxury of presuming it couldn't be us ending up on one of those slides. So the old message, historically, a lot of textbooks said that this disease was more common in men than women. Twice as many men as women were reported as having aortic dissections. But there was this really fascinating study that came out of Japan, and it was just published in 2023. And in this study, they took every person in this region of Japan who had had their heart stop or experienced a cardiac arrest outside of the hospital, was transported to the hospital with paramedics, CPR in progress. Some of them were successful, and those patients maybe survived. Some of them did not survive. And whether the patients lived or died, they all got a CAT scan. And from that study, we saw something that was really striking, even though historically we always thought twice as many men as women got an aortic dissection. What we saw here was that women had these aortic tears just as frequently as men, but they were far less likely to make it to the hospital alive. And so this study really changed that paradigm in thinking that this was more a disease of men than women. The women who experienced an aortic dissection were older. They tended to present a little later with more advanced disease to the hospital. And they typically had more aggressive clinical courses and poorer outcomes. And so they were disproportionately accounting for the individuals who maybe didn't make it to the hospital alive. So what is this aortic dissection that I'm talking about? Well, this is a zoomed in view of the 3 layers of the aortic wall. And what you see here at the level where these 2 arrows are, this is showing an area where there is a tear or a defect in that inner layer called the intima of the aortic wall. So the blood is supposed to be confined to the inside of that intima, but when there's a tear in the intima, the blood leaks from the inner portion of the aorta into that middle media layer. And the symptoms, as we've already discussed, often can resemble a heart attack, which is more typically a problem that is associated with the small coronary arteries that feed the heart, when it's really actually being caused by a bigger problem in the bigger blood vessel, the aorta. Aortic dissections occur when a tear in that intimal layer leads to separation of the layers of the aortic wall. And I'm going to show you what that looks like a little bit more in this slide. So when that inner layer rips, the blood gets redirected into the tear itself. And that creates a little pocket where there's this artificial space between the inner layer and the middle layer. The dissection is like having a split in the aortic wall that traps the blood coming from the heart. And this alters the blood flow. So instead of passing through a single barrel, it's now passing through a double barrel. So if you look at this picture of a torn aorta, this torn layer here where it's become a double barrel, that's not normal, that's a dissection. And you see it in crossways here where the blood is supposed to just be flowing through this one barrel or lumen, but instead the blood is split through the tear and it is going into both that true lumen and the false lumen. It can pressurize that outer false lumen in a way that can actually limit the blood flow in our true lumen, so any of our organs in the body can potentially have life-threatening changes in their blood supply because of the dissection. So organ perfusion is at risk when there's an aortic tear. And instead of the blood going to our vital organs, the blood is trapped within the wall of the aorta. And as more blood gets trapped, the tear itself can get bigger and can worsen the problem. This can lead to strokes if not enough blood is reaching the brain. It can damage the heart valves if the dissection is very, very close to where the aortic valve is at the beginning of the heart. And most deadly, because this wall is now separated, it's thin and it's pressurized, there can be a complete tear all the way through the wall of the aorta, which is unfortunately why many of these patients will not make it to the hospital alive. That's called a rupture when there's a full thickness tear through the aorta. So what causes that tear in the first place? Because it sounds pretty bad and we all want to make sure we don't end up with a tear in our aorta. Just like a rip in fabric, a tear in the aorta can come from an underlying weakness in the aortic tissue itself. That weakness may be there from the start, meaning something you were born with or born predisposed to. It may develop gradually over time, or it can happen quite quickly. So causes include inherent weaknesses due to genetic disorders, slow developing weaknesses that can come from untreated high blood pressure over time, and sudden damage can come from traumatic events like a car accident. The symptoms of aortic dissection are going to sound really similar to things you've heard at other talks in this series about heart attacks and strokes. Whatever the cause of the tear, once a tear has developed, almost universally, pain follows. This is a painful condition. And medical textbooks will usually describe it as a severe chest pain that starts abruptly and is associated with a ripping sensation. And that ripping sensation and the severity of the pain can be in contrast to the more typical description of a heart attack type chest pain, which can be characterized by feelings of pressure or tightness. But in the real world, our bodies and our aortas have not read the textbook. And these symptoms are not always so different, which can make the diagnosis of aortic dissection especially challenging, even for doctors. And that can lead to delays in treatment. So next we're going to go over 8 key facts so that you walk away feeling better prepared to maybe recognize the signs of an aortic dissection. There are 8 things I want you to remember. So number one, and I would say if you remember nothing else from the talk tonight, what's on this slide is really important. So that's the urgency of this condition. If someone that you care about is experiencing severe ripping type of chest pain that is unlike anything they have ever felt before, you've got to get them to medical attention immediately, because this is a very unforgiving disease without the appropriate treatment. But with appropriate treatment, outcomes can actually be very good. The thoracic aortic dissection, it's a true medical emergency. We already talked about how a lot of the women in that Japan study just weren't making it to the hospital alive to even have the opportunity to get a diagnosis. And unfortunately, without treatment, the death rate increases by 1% to 3% every hour. It really stands alone in medicine in that degree of the clock is really, really, really ticking for us. So getting a timely diagnosis, and when surgery is needed, a timely surgical repair is really, really important. We don't want to have any delays. Number two, pain is really the hallmark of this disease. Severe pain is the main and most common symptom. And if someone has the type of pain like I'm describing who's in your vicinity, please help them to get immediate medical attention for sudden onset of severe pain in the chest. Sometimes it's in the stomach, especially if the abdominal organs do not have adequate blood flow. It can be in the back. It can be felt in the neck. The pain is likely to be sharp. It may be described as tearing, ripping, moving, or radiating to places. And some people report feeling that something is really very wrong. Number three, and this is a challenge, as the heart surgeon, I get called when they've already made the diagnosis. But it's very, very common when I'm getting calls from our surrounding hospitals that maybe don't have an aortic surgeon that's able to manage this condition, and they're calling us asking for help to bring the patients over into community system. It's very common that the patient may have come into the emergency room at 5 in the morning, and we're getting a call for help at 5 o'clock at night because initially they thought the patient was having a stroke and started workup and treatment for something else, when in fact it was an aortic dissection. So the aortic dissection, it is a great mimicker. Heart attacks or strokes are far more common than dissections, but if a heart attack or other diagnosis is not quickly and clearly established, then doctors really need to start thinking about aortic dissection as a possibility, and it needs to be ruled in or ruled out. This is especially important for any patient who has a family history of aortic conditions, or someone who maybe has a known genetic syndrome that may predispose them to an aneurysm or a dissection. Next key fact is the importance for this condition of imaging. CAT scans are really the mainstay of diagnosing this condition. Having CAT scans that can be performed more rapidly and widely available has really been important in terms of improving outcomes for patients with this condition. You may remember decades ago when access to a CAT scan often required a long, long wait because we didn't have the resources to scan people quickly. CAT scan tells us really quickly whether there's an aortic dissection. And there really are only 3 types of tests, including the CAT scan, that can show us a tear in the aorta. CAT scans, we see tears in the aorta. MRI takes longer than a CAT scan to perform, so it's not usually the go-to first-line test, but it can show an aortic tear. And echoes, especially echoes that are done looking at the heart through the esophagus, can also show us that tear. And it's important to note that basic tests like a chest x-ray or an electrocardiogram do not rule out an aortic dissection. Those will oftentimes be falsely normal in this situation. Number 6, there are risk factors that are very strongly linked to this condition. So aortic dissections often are preceded by an aortic aneurysm, meaning an enlargement or ballooning of the aorta itself. So anyone who has an aneurysm in their aorta, whether it's in the chest or in the abdomen, is someone who is at risk because as our aorta gets larger and larger, just like a water balloon that's been stretched too full, the wall gets thinner. And the thinner the wall of the aorta is, the less it's going to be able to accommodate our changes in our blood pressure. So I mentioned earlier that I think about the aorta as being a really extraordinary, very dynamic organ in our body. When you check your blood pressure, you have the high number at the top and the lower number at the bottom. The aorta's job is to be able to tolerate massive fluctuations in the pressurization and the flow of that blood that the heart is pumping out to our body, and to be able to facilitate getting the blood safely to our other organs. But its ability to tolerate massive changes and fluctuations in the blood pressure, especially when its thinner wall, can be more limited. So aneurysms are clearly linked to a risk of aortic dissection, and aneurysms can also lead to full-blown rupture, where this didn't start as a dissection with that kind of a double barrel, but it was a tear that tore all the way through the aorta, which causes major bleeding. Another risk factor is anyone who has a personal or a family history of this type of condition, whether it's an aneurysm or a dissection, that puts the other family members at risk. And I really work hard with the patients who come to see me in clinic who either have aneurysms or are survivors of dissection to make sure that everyone understands the importance of first-degree relatives being checked to see if they might also have an aneurysm. And checking for that often is something as simple as an ultrasound or echo to see if the aorta is normal-sized or not. So appreciating that these can run in families is very important. And then the genetic syndromes are rare, but of the individuals who have dissections, they are more common than they are in the community. And so there are a variety of common conditions like Marfan syndrome, Louis-Dietz, Ehlers-Danlos. Those are names that you probably haven't heard before, and it's not necessarily helpful to memorize them at tonight's talk, but especially things like Marfan syndrome. There's a lot that's been learned about the genetics that are involved in those conditions, and people can actually be tested for them to know when they've experienced an aortic aneurysm or dissection whether there is an inherited genetic cause that other family members can be checked for with a genetic test. And about 5% of our population has what's called a bicuspid aortic valve. And what that means is instead of the more common 3-leaflet configuration for the aortic valve, which 95% of the population has, for 5% of us, it's just 2 leaflets. And 2 leaflets often work pretty well, but not 100% perfect. And because of the embryologic development of the aortic valve and its nearby aorta, there's a very clear link between bicuspid aortic valves and having more commonly aneurysms in individuals who have the 3-leaflet aortic valve. Next point is that there are triggers, meaning things that can take a normal healthy aorta and convert it into a dissected aorta. So lifestyle and trauma can trigger aortic aneurysm and or dissection. And this is something that we actually often see in our communities, either an individual who has uncontrolled high blood pressure and comes into the emergency room with the symptoms we were talking about earlier, that typical type of chest pain, and their blood pressure, the high number is over 200. That's a lot to even put a normal aortic wall through, and sometimes that high blood pressure alone can be the difference between a tear or no tear. Unfortunately, other things that we do, like injuries to the chest, extreme straining like poor King George II, or even straining associated with bodybuilding can lead to aortic tears. Illicit drug use, and we see that quite a bit in the Fresno area too, because we have such a high burden of meth use in our community. And methamphetamines absolutely astronomically raise the blood pressure. And methamphetamines can absolutely tear an otherwise previously normal aorta. And aneurysms are also common. So someone who's using illicit drugs may not know that they have an aneurysm, and then the blood pressure is sky high because of illicit drug use. Poorly controlled high blood pressure, we've already talked about. And then one thing that's an interesting challenge to treat is that the state of pregnancy and the hormone changes associated with successful pregnancy change the strength of our blood vessels. And part of that's how we successfully get a pregnancy to term, but part of it can also trigger, especially for maybe a young woman who may not be aware that she has an underlying aneurysm or those genetic conditions that I mentioned. For young women, these dissections actually can happen when they're maybe 20, 25 and pregnant for the first time. And that was a not uncommon phone call I would get when I was training at the Cleveland Clinic, and there was a young woman about to deliver a baby with a dissection or aneurysm. Finally, we're at number 8, and they're only number 8. There are only 8, so we're almost there. Prevention. So medical management really is essential to preventing ever meeting me in the emergency room because I'm trying to save your life by fixing this aortic dissection. If you have thoracic aortic disease, the good news is this is a treatable condition. Meaning if you have an aneurysm, if we do a really good job with blood pressure control and close monitoring, we often have an opportunity to either get safe, planned elective surgery done with really good outcomes for patients, or maybe even avoid surgery altogether if we take really good care of that aorta. And genetic counseling also has a role under certain conditions. So it's really important if you know or think you might have a thoracic aortic problem to make sure that you have a doctor that you know and trust so that you have a good plan in place for how you're going to keep your aorta healthy. So let's review the symptoms. The symptoms of an aortic emergency or an aorta attack, they include chest pain, sometimes jaw pain. It can really look similar to a heart attack. Sudden stabbing pain. It might go to the neck, the jaw, the abdomen, the chest, the shoulder. Fainting, breathing difficulties, sudden weakness that can look just like a stroke. When those types of symptoms arise, whatever the cause is, that is someone who needs to be evaluated immediately because there are a variety of different types of medical emergencies that could explain those symptoms, and many of them can be life-threatening. So now we're going to talk briefly about how as heart surgeons we treat some of these conditions. These are pictures I've taken online because we are very mindful of our patients' safety, and we've actually kind of moved away from taking these glamorous, beautiful photos of these extraordinary things that we get to see as heart surgeons, because if you were asleep, you may not want a whole audience of people seeing what your aorta looks like. But if you look at this picture on the left, this angry, ominous, dark, black aorta, that is an angry aorta that is on the verge of rupturing. And the reason it looks that unusual color, normally the aorta is this beautiful pearly white with little fine red stripes that are the little blood vessels for the aorta. And what you see here is it's purple, it's thin-walled, because you're actually looking at that outer barrel, the second barrel that doesn't belong there, and that's blood that is trapped in the middle portion of the aorta about to rupture or burst through. And then on the other side, you see a beautiful surgical repair that's been done to save that patient. And depending on where the aortic tear occurs and how it changes the blood flow to our vital organs, the consequences of an aortic dissection can range from something that is relatively harmless and effectively managed with medications to things that are imminently life-threatening, where many patients don't even make it to the hospital alive. Individualized treatment teams can involve a lot of doctors, not just a heart surgeon. So I want to give some credit to the emergency medicine doctors who recognize these conditions and diagnose them with CAT scans. Cardiologists are a very important member of the team with lifelong management of these conditions as well. The heart surgeons and the vascular surgeons who often will work together collaboratively to fix the aorta. And our radiology doctors who step up to give us a chance to save someone's life when they have a dissection by calling us right away to say, hey, this CAT scan, there's a dissection, we've got an emergency problem, we gotta move. The two main treatment options, surgery to repair or replace the injured section of the aorta, or medications to lower the blood pressure and the heart rate to reduce the risk of rupture. The first type of aortic dissection is the more common type of aortic dissection at the very beginning of the candy cane right next to the heart. That's called a type A aortic dissection. And it begins in the ascending thoracic aorta right at the beginning. It can be immediately life-threatening, and it generally requires emergency open heart surgery. So what you see in the picture here, big old ugly looking aorta from the outside. On the inside, there's a tear in that intimal layer, that extra lumen that shouldn't be there, and this is starting right next to where the heart would be, although the heart is not shown in this picture for simplicity. So generally, the way we fix this procedure as heart surgeons, if we have time at the end and you want to ask me more about how we do this, I'd be happy to tell you, because I think it's really one of the truly miraculous pieces of modern medicine that we're even able to do this type of surgery safely. We use a heart-lung machine. We cool the body usually to about 20 degrees centigrade to protect the brain and all the vital organs. And in order to actually fix where those inner tears are in the aorta, we actually stop the circulation so that we can look inside of the aorta to make sure that we get all of those intimal tears repaired or replaced during the surgery. And that's something that is a uniquely physiologically complex operation to do in the early stages. You know, the outcomes for such big surgery where you stop the circulation, meaning no blood flow, just cold. The outcomes early on were not very good, but in 2024, we lose fewer than 10% of patients who come to the operating room for this type of surgery. And that's in contrast to there are very few survivors of this condition if they don't get surgery. So it's really very, very extraordinary. Now, a type B aortic dissection, which we see plenty of here in Fresno, it's a little bit less common. And the tear actually starts right past the blood vessel that delivers blood flow to our left arm. And so it's further on in the candy cane, right before the aorta is starting to wrap down and come towards our abdomen and our feet. And this is an interesting disease because sometimes it's managed well with medications. Sometimes we're able to treat it with a stent, meaning not opening the chest, doing it minimally invasively. Very rarely requires open surgery. And so this type of a tear can require immediate intervention, but oftentimes we're able to temporize things with medications, maybe do a stent later on during the hospital stay. And the timing of that intervention really depends on how the tear is affecting the blood flow to the important organs in the body. If the important organs to the body do not have adequate blood flow, sometimes we actually intervene immediately. So treatment can include the medications, stenting, and rarely big open surgery through the left chest. So if you never want to meet me in the emergency room and have me look you in the eye and tell you, we got to take you right to surgery to fix your aortic dissection, here's what you do. You do have control, just like many heart attacks and strokes can be prevented, and the themes in prevention and maintaining your aortic health are very, very similar to general recommendations for cardiovascular health, and these are things that work. Checking your blood pressure regularly. And if you start to notice a change, dissections are associated with high blood pressure. So if your blood pressure is starting to slowly creep up from 1 week to the next, consider taking that seriously so that you don't have to ever meet me in the emergency room with a blood pressure over 200. Avoid recreational drugs. There are a lot of members of our community that are experiencing substance use issues, and many of the substances commonly used in our community, whether it's meth or cocaine, do cause these astronomical blood pressures that absolutely can tear the aorta. If you don't smoke, don't start. There is a very clear relationship, especially with abdominal aortic aneurysms and smoking. And if you do smoke, ask your doctor to help you find a smoking cessation program that can help you to be successful with quitting. And the importance of a healthy diet and regular exercise, even though, extremes of weightlifting, maybe not a good idea if you've got a big aortic aneurysm, but regular moderate exercise is absolutely beneficial for aortic health. So to recap, this aortic dissection, it is a life-threatening emergency. My goal for this talk tonight is I hope that no one in this room, none of your friends and family members join those 4 individuals on the slides at the beginning of the talk. They're not the only famous people that experience this, but it's a common enough condition, even though you might not have heard about it before tonight, it's a common enough condition that a lot of famous and non-famous people have unfortunately lost their lives to it. About 40% of patients die immediately, don't make it to the hospital alive, usually because of a full-blown rupture and bleeding. The risk of dying can be as high as 1 to 3% per hour until an appropriate diagnosis and treatment is provided. So if you have symptoms like what we talked about tonight, especially with that severe chest pain or symptoms of a stroke, call 911, get the emergency care you need because you deserve it. And when the diagnosis is made, you may be transferred if you're in a smaller community hospital in the surrounding areas here. You may get transferred to a bigger hospital like our Community Regional Medical Center, like our Clovis Hospital here, or even our Heart Hospital. I did our first dissection repair at Clovis because, as many of you are aware, we're really proud of our heart surgery program here at Clovis. And we were able to take a patient right from the emergency room to the OR because as a community we've worked really hard to expand our heart surgery resources right here in Clovis. And so we're now doing this type of surgery not only at our big trauma center downtown, our experienced heart surgery hospital, Fresno Heart, but also here at Clovis and with really, really good outcomes, which is exciting for our community. So for my final reflections, it's your aorta, it's your health. I hope you'll think of me when you get up tomorrow and it's still raining. Go for that walk anyways, somewhere that you feel comfortable and safe, because your aortic health depends on it. Check your heart rate and your blood pressure, and if your blood pressure is creeping up, take it seriously. Appropriate treatment can convert a nearly universal risk of death to a greater than 90% likelihood of survival. That's extraordinary. And survivors require lifelong monitoring and surveillance, really to ensure the best possible long-term outcomes. So this is a good slide to take a picture of if you thought what we were talking about tonight with the aorta was kind of cool and you'd like to leisurely read some more about it. The John Ritter Foundation has assembled a bunch of resources to learn more, because usually when people have an aortic dissection, they've never heard of this before. And then when they survive, they have no idea, and they don't know anyone else that's experienced it. And so that's a really great website to learn more about aortic dissection. The Heart Association and our Vascular Association also have great resources about aortic health. And then for the genetic syndromes like Marfan's, there are also really great resources online. So I'd like to thank all of you for your generous attention tonight and for braving our terrible, terrible rain. I don't know if it's a full-blown atmospheric river out there or not, but it was a lot of rain. And I'd also like to thank my partners, without whom I wouldn't be able to do these types of surgeries. And I both enjoy doing these surgeries with them and also helping my partners to do this type of surgery so that we can really keep our Central Valley healthy and continue to work on, even getting those aortic outcomes to be even better than that over 90% number. So thank you all for your attention. I look forward to any questions that you might have.